All right, well, thank you everyone for joining. I know we still have folks trickling in, but we're going to go ahead and get started. So welcome to the fourth Apple Health Expansion webinar, where we'll be discussing eligibility for the upcoming Immigrant Health Program. My name is Sheldon Pranty. I'm one of the lead policy managers for the Apple Health Expansion project. And just some kind of housekeeping things before we get into the actual presentation. So this webinar is being recorded, and staying in this webinar, you consent to being recorded. This Zoom event is in webinar mode. Attendees will not have microphone or camera access during this online event, and attendees' voices, likenesses, and/or images will not be captured.
I don't know.
And we have a special thanks to Nikki Cherry and LaDonna Gabrielson for ASL interpretation, and we also have closed captions available in English and Spanish. We will share the closed captioning links several times throughout the webinar, and there will also be a live Q&A at the end of the presentation, and all web pages and additional resources will be shared at the end of this slide deck. And your presenter this afternoon is Melissa Rivera from the Healthcare Authority, and she's going to be going over information about the Apple Health Expansion. So Melissa, please go ahead and take it away.
Welcome to the webinar on Apple Health Expansion Enrollment Part 2. Today's webinar includes closed captions available in English and Spanish. To access the closed captions in either language of your preference, click on the link that will be provided to you in the chat. Chat and reactions are disabled for this webinar to avoid distractions. If you have questions, please hold them until the end of the presentation. And when you submit them, put them into the Q&A feature, and we will do our best to answer them during the Q&A. Any questions not addressed during the webinar will be compiled and made available in a frequently asked questions document posted on the Apple Health Expansion webpage. Presentation slides and the recording will be available also on the Apple Health Expansion webpage. Based on previous requests, translated slides will be available in Amharic, Arabic, Cambodian, Chinese, Russian, Spanish, Tagalog, Ukrainian, and Vietnamese. All mentioned resources and links are available at the end of this presentation. This webinar will be recorded and posted online. Apple Health Expansion Enrollment, Part 2. The topics that will be discussed will be a review of the current Apple Health programs. We will then go into detail about the policy and eligibility for Apple Health Expansion, the immigration statuses, application pathways, managing Apple Health Expansion, when to apply, and how to prepare when it's time to apply. Current Apple Health programs. A refresher on the Apple Health programs that are still available even when Apple Health Expansion is implemented. The list of programs on this slide cover individuals who do not qualify for federally subsidized healthcare coverage because of their immigration status and may continue to be eligible for these programs. Apple Health Expansion. Program policies will have the same process as our other Apple Health programs, such as eligibility, enrollment, redeterminations, and renewals. Individuals eligible for Apple Health Expansion will be enrolled into a managed care plan, and based on where they live, they may have up to 4 United Healthcare Community Plan, Community Health Plan of Washington, and coordinated care. Retroactive coverage will not be available for Apple Health Expansion. However, clients may receive retroactive coverage under the Emergency Medical Program if they have a qualifying condition in the retroactive months, and after pregnancy coverage if they are within 12 months of their pregnancy ending. There will not be a resource or asset limit for this program, and long-term services and supports will not be a covered service. Those who may be eligible for Apple Health expansion must be Washington residents who are age 19 and older, who have income at or below 138% of the federal poverty level, not eligible for other Apple Health programs based on their immigration status, or qualified health plans with advanced premium tax credits, or federally funded medical programs. Immigration status. Individuals with the following immigration statuses may be eligible for Apple Health expansion: applicants for asylum, applicants for withholding of deportation or removal, registry applicants, order of supervision, applicant for cancellation of removal, suspension of deportation, lawfully admitted with expired or revoked immigration status, no immigration status, and deferred action for childhood arrivals, also known as DACA. Those with an asterisk next to them must not be employment authorized. And effective November 1st, 2024, deferred action for childhood arrivals, or DACA, recipients will be included in the definition of lawfully present and will be eligible for advanced premium tax credits and purchase a plan to determine impacts to DACA applicants and eligibility for Apple Health expansion. Individuals with the following immigration statuses are not eligible for Apple Health expansion if employment is authorized: applicants for asylum, applicants for withholding of deportation or removal, registry applicants, applicants for special immigrant juvenile status, order of suspension, applicant for cancellation of removal, suspension of deportation. Immigration status eligible for Apple Health and tax credits. Individuals listed here with the following immigration statuses are eligible for Apple Health and advanced premium tax credits: U.S. citizens, nationals, lawful permanent resident within their 5-year bar, COFA, asylees, refugees, temporary protected status, Cuban Haitian entrants, parolees, battered spouse, child, or parent, granted withholding of deportation, removal, non-immigrants with work visa, student visa, U visa, or T visa. In continuation of individuals eligible for Apple Health and advanced premium tax credits, deferred enforced departure, deferred action status excluding DACA, lawfully temporary resident, administrative order stain removal, member of a federally recognized Indian tribe or American Indian born in Canada, applicants for temporary protected status with employment authorization, applicants for special immigrant juvenile status, applicants for victim of trafficking visa, applicants for adjustment for lawfully permanent resident status. While some of the immigration statuses in both groups are similar, Having the status of employment authorized provides an individual with a valid Social Security number. Those issued a valid Social Security number or an individual tax identification number allows the individual to file taxes and eligible to get federal tax credits, making them ineligible for Apple Health expansion. Application pathways. Individuals can apply for Apple Health expansion at 8 a.m. on June 20th. Coverage will begin on July 1st. This is a limited program and expected to fill quickly. There are several ways to apply: online, calling, or in person. Today, individuals can access Apple Health expansion in the same exact way they do for our other Apple Health programs. Washington Health Plan Finder will be one of the two entry points. Those who are the age of 19 to 64 years old should apply through the Washington Health Plan Finder online at wa.healthplanfinder.org, or they may download the WA Plan Finder mobile app. They can call 1-855-923-4633 or submit a paper application or in person with the assistance of a navigator. To search for a navigator in your area, a link has been provided on this slide. You can choose your language preference as well as the zip code of where you live to search the nearest navigator to help you sign up. Those who are 65 years old and older and interested in Apple Health expansion should apply as they do now through the Department of Social and Health Services Community Service Office. They can apply online at washingtonconnection.org, or they may call 1-877-501-2233. They can submit a paper application or in person at a community services offices near them. A link has been added on this slide to search for the nearest DSHS office. Managing Apple Health expansion. Apple Health expansion will have limited enrollment. Once the limit has been met, an applicant who is otherwise eligible will receive a denial notice. All clients may purchase a qualified health plan. Clients under the 250% federal poverty level are eligible for Cascade Care savings if they enroll in a Cascade Care plan. Reminder that staff will accept client attestation of income, citizenship, immigration status, Washington residency, and all other eligibility factors. If the individual indicates on the application a need for emergency medical services and Apple Health expansion enrollment is not limited, they will be approved for Apple Health expansion. If the limit has been met, the case will be reviewed for the emergency medical program. Individuals denied in Washington Health Plan Finder due to the limit being met will receive an eligibility notice with healthcare coverage options. Clients under 250% of the federal poverty level are eligible for Cascade Care savings if they enroll in a Cascade Care plan. Please note, regardless of Apple Health expansion eligibility, Individuals who are denied due to the enrollment cap will have the option to apply for emergency medical program or purchase a Cascade Care qualified health plan. There will be a maximum amount of 13,000 individuals who can be approved for Apple Health expansion. We have dedicated an amount to 1,300 for our classic population and 11,700 for our Magi population. Out of the 13,000, approximately 3,000 individuals will auto-transition to Apple Health expansion as part of July 1st. The list of individuals include Apple Health for kids turning 19 in June or July, after pregnancy coverage, emergency medical services, extended foster care kids, those who are on a qualified health plan and their income is at 138% of the federal poverty level. Those transitioning from the other programs into the classic Apple Health expansion include the qualified health plans at 138% of the federal poverty level for those who are aged 65 years old and older, as well as those who are on the emergency medical services. This is a sample of the letter that will be sent to individuals, Classic or Magi, who are enrolled in Apple Health Emergency Medical Program in June. The letter will be sent to them either by mail or USPS depending on their preference. The content of the letter for both population will be the same. Those who are qualified in a qualified health plan or QHP will be transitioned to Apple Health expansion and must be enrolled in a QHP for May and be eligible for Apple Health expansion. This means those who signed up in April are required to pay for their May coverage to be deemed enrolled. Those who are disenrolled by their carrier for any reason prior to the transition in mid-June will not be transitioned to Apple Health expansion regardless of available grace periods. This is a sample letter, the EE013, that will notify individuals who are on a QHP and will transition to Apple Health expansion. This is a screenshot of what to expect when someone who is approved for Apple Health expansion in the Washington Health Plan Finder. A follow-up letter will then be sent notifying the individual of their approval for Apple Health expansion. This slide is a timeline that shows those who are active on a QHP in May will be sent a letter notifying they may qualify for Apple Health expansion and to take action. Individuals active on Apple Health for kids in June or July who are turning 19 years old, and individuals where their coverage for after pregnancy coverage is ending in June or July who qualify for Apple Health expansion will have coverage begin July 1st. They must complete a renewal in order to find out if they qualify for Apple Health expansion. As mentioned earlier, Apple Health expansion enrollees will be enrolled in a managed care plan. The plans available will be Molina Healthcare of Washington, United Healthcare Community Plan, Community Health Plan of Washington, and coordinated care. Coverage for Apple Health enrollees will be July 1st, 2024. Changes made to managed care plans are effective the first day of the following month, and if a change in plan needs to occur, it's the same process as today. Application time. Individuals can apply for Apple Health expansion through Washington Health Plan Finder or Washington Connection no sooner than 8 a.m. on June 20th. Applications submitted through Washington Health Plan Finder will receive instant eligibility determination for Apple Health expansion. Applications submitted through Washington Connection will be processed in the order received. DSHs will prioritize manual applications to ensure timely processing. Enrollment is limited. Program is expected to fill quickly. If an application is submitted prior to June 20th, the application will be reviewed for other programs, not Apple Health expansion. If the individual is not eligible for any other programs, they will receive a denial notice. Once capacity for the Apple Health expansion has been met, people will receive a denial letter indicating the enrollment limit has been met, and the correspondence letter EE015 will be sent with the text that states Washington Apple Health expansion enrollment limit has been met. New customers are not currently being accepted. Getting ready to apply. Self-attestation is accepted. However, if the individual is not sure of their legal status, we recommend they have documentations with them to avoid a delay in getting coverage. Supporting documents are things such as a driver's license, identification card, or foreign passport. Those who live with a person who is applying for Apple Health expansion do not have to verify their identity. If the person was issued a Social Security number, have them provide it. The Social Security number is only used to determine eligibility by confirming identity and confirming immigration status. We do not share this information with any immigration agency. If the individual has an individual taxpayer identification number, that is not needed. For those who apply through Washington Health Plan Finder, will require that the primary applicant has passed identity proofing before continuing with the online application. So it is important for the individual to verify who they are by having someone that verifies their name, date of birth, things such as their weight, race, etc. Those who are working with a client and can verify who they are in person will not be required to upload proof of the documentation. Again, if working with a navigator, the navigator may be able to verify identity of their clients and will not need to upload documentations. It is important the name is entered into the system how it is spelled on the documents provided. If the individual has two last names, follow the application data entry standard on how names should be entered. For individuals that are 65 years old and older who walk into a community services office, a public benefit specialist will be able to verify identity. To help in the identification process, individuals should bring their most current documentation. For individuals applying online through Washington Connection, There is no identity verification needed to submit their application. It will be manually verified by a DSHS staff when the application is processed. One thing to note, applying online through Washington Connection is the quickest way to get your application into the system. Another reminder that self-attestation is accepted. However, the individual will need to know the amount of their gross monthly income in order to determine if they qualify for Apple Health Expansion. If they do not know how much they earn on a monthly basis, they should have with them a few pay stubs, month or 2 months worth, or receipts that show their earnings, a letter from their employer, or a phone number to call to get that information. For more examples, view the link on this slide, a chart of acceptable documents. When reporting income for individuals whose income varies seasonally, individuals can choose to use either the point-in-time methodology or by calculating the monthly average. An example would be those who are fishermen or farmers who work seasonally. Self-attestation is accepted. However, the client may be required to provide proof after application for a post-eligibility verification. Resources. To share outreach events, a flyer regarding Apple Health Expansion has been created and available in 15 languages. For more information, visit hca.wa.gov/AH-expansion. If you missed our previous webinars, they have been recorded and can be viewed at your convenience. Go to our hca.wa.gov/AH-expansion to view our previous slides, and they are available in a variety of languages. To stay connected, don't forget to subscribe for Gov Delivery messages. Apple Health Expansion is our latest topic. Here is a list of Apple Health Expansion resources. We have the client webpage on Apple Health Expansion, stakeholder webpage, more information regarding our other Apple Health programs for non-citizens, and more information about the enrollment cap announcement. For more information on Apple Health Expansion, go to our Apple Health Expansion at hca.wa.gov.
All right, so that will conclude our presentation for the
Welcome.
live portion of this. And then we're going to, as some of you may know, we have a Spanish webinar going on at the same time. And to allow them to come over into this webinar for a live Q&A, we are going to pause until 3:40, and then we'll come back and do a live Q&A for any questions that you might have. So we will pause until 3:40. Thank you.
Welcome back, everyone. We're going to get started with our live Q&A. Give us just a moment while we spotlight our ASL interpreter. And I believe we have 2 interpreters. We have an English and a Spanish. Is that correct?
Yes, that's correct. Thank you.
Can we see both of those folks on screen right now? All right, there we go. Thank you.
Hello. And just to clarify, you will not see me unless somebody makes a comment or a question in Spanish.
Okay. Well, now it's time to get started for our live Q&A. So we have a number of questions that have come in. And we're just going to go ahead and get started with some of those this afternoon. So one of the most common questions that we get after one of our live webinars is, where can I find these materials? Where will they be posted? Will they be translated? And yes, you can find all of those materials on our website. We'll post those links in the chat for you all this afternoon. All right, so we also have a number of questions about capacity. This is a limited capacity program. We talked about a capped enrollment. So the question is, when the capacity is met, can you confirm how they will receive the denial letter? Is it a real-time message, a mailed physical letter, or an email?
Yeah, so the answer to that, so for DSHS and for Helpline Finder, a notification will go out to the individual. For DSHS, it will be a letter. For Helpline Finder, it will be based on the preference that the individual selected for either being notified by mail or email. And that letter will go out, or email notification will go out to the client, letting them know that they've been denied due to the cap.
You, Sheldon? So June 20th is coming up. People are pretty excited about the June 20th application date. Will applications be accepted both on June 20th and the 21st, or only on June 20th?
At this point in time, June 20th is the only date that we're accepting applications. If we were to somehow not meet the cap and there was a need to leave it open further, there's a possibility that it could be open the 21st, but at this point, the only day that it is planned to be open is on June 20th.
Okay. So let's see. Will we have to upload POI immediately after submitting an application, or should we wait until client receives a letter requesting said POI? And if you could please also state what POI means for the folks.
Yes, so that's a great question. So POI would be proof of income. So for both DSHS and through Helpline Finder, proof of income will not be required at the time of application. As it was mentioned in the webinar, we will accept client self-attestation of income. But if there is not ability to cross-match that information that they've self-attested to, there's a possibility that they will get what's called an information request letter that will go out to the client and asking to provide proof of their income. If everything that they submitted through self-attestation comes back and the cross matches are correct, then they will not receive that letter. So they would only receive that letter if our systems are unable to verify what they've self-attested to.
Thank you. Will anyone currently on AEM automatically be rolled over to the expansion program?
Yeah, so everyone who's currently enrolled into AEM in the month of June will be moved automatically to the Apple Health Expansion Program. So anyone that's currently in that program through the end of June will be moved over.
Are there different income or eligibility requirements for AEM?
It's the same, and it's the same FPL standard, so there's no difference in that, and that's why we're able to automatically move them into this new program.
Thank you, Sheldon.
Yes.
La pregunta que se hizo fue si las personas que actualmente están en el programa de cobertura médica emergente van a ser trasladadas al nuevo programa de expansión. Y actualmente las personas serán transferidas en julio 1, los que están activos en la cobertura médica emergente.
Thank you, Gio. Will skilled nursing or assisted living facility levels of care be covered?
So for Apple Health expansion, it will not cover long-term care services. And for the second part of that, I am not sure on the answer completely on that. So that's one we can take back um, and go over when we do the final FAQ.
Okay.
La pregunta que se hizo fue si la cobertura de largo plazo será cubierta. Y en este momento, bajo el programa de la expansión, esa será una cobertura que no está disponible.
Okay. Can an undocumented immigrant apply for Apple Health expansion under the family household who are U.S. citizens?
Yeah, so if someone, for example, like their spouse is a US citizen and they're undocumented, they can still apply for the program. And if they're found eligible and there is space available in the Apple Health expansion, they can be approved. So it wouldn't make a difference if there was a mixed household as far as citizenship or immigration status.
La pregunta fue si alguien que no tiene documentos puede aplicar si los otros miembros de su hogar tienen un estado legal o son ciudadanos. Y la respuesta es sí, sí pueden aplicar. No importa qué estado legal o ciudadanía tengan los otros miembros del hogar, la persona que está aplicando y no tiene documentos puede aplicar para la expansión.
We also have some questions about the 5-year bar and lawfully present. So does the Apple Health expansion include refugees that are lawfully present?
So refugees are exempt from the 5-year bar, and they are eligible for regular Washington Apple Health or for federal subsidies as well. So they wouldn't qualify for the expansion. La pregunta fue si para los que son refugiados, son elegibles para la expansión o que y la respuesta es no, porque ellos tienen un estado legal permanente y son elegibles para los programas normales de Apple Health o para aplicar para subsidios federales por medio de los cobertura que está disponible por medio del Benefit Exchange.
Okay, we have another question about people transitioning into the Apple Health expansion program. We previously mentioned this includes individuals on the AEM program, after pregnancy care. And the question is, are all these enrollees who are set to transition included in the 13,000 capped number?
Yes, that is correct. So the 13,000 total cap is including people that are being automatically transitioned into the program.
La pregunta fue si de los grupos que están siendo cambiados o transicionan de un programa a la expansión, si ese número es parte del cupo de 13,000 que están disponibles para la expansión. Y la respuesta es sí, ese número es parte de los 13,000.
If someone is currently pending AEM, will they be automatically enrolled as part of that transition?
That's one we can take back, but I believe currently at the time they would not be transitioned, but we can double check and provide an answer on that afterwards.
Okay.
La pregunta fue para los que están están pendientes en la aplicación para cobertura médica emergente, cuyas aplicaciones no han sido aprobadas todavía, si ese grupo va a ser transicionado al programa de expansión. Y esa es una pregunta que vamos a tener que llevar y poder contestar correctamente. No tenemos la respuesta para eso en este momento.
Okay, and then of course, the big question that everyone wants to know, is there going to be a wait list once the cap is met?
So at this point in time, there's no waitlist option. We're looking at the possibility of having that for the future. But for implementation and for the moment, there is no waitlist, but it's something that we're looking into for the future. But at the current time, there is no waitlist.
La pregunta fue si una vez que se llenan los cupos, si habrá una lista de espera para todos los demás que están aplicando. Y en este momento no habrá una lista de espera. Es algo que se está pensando y se planea para el futuro, pero en este momento no hay lista de espera.
All right, thank you, everyone. I think we'll move to our next slide. We have a number of resources that we can share with you. We have recently published a toolkit as well as a client flyer that is available in, I believe, 15 languages. We'll be dropping that in the chat as well.
Hay información que se está haciendo disponible, que se estará poniendo en el chat para que se pueda propagar la información sobre la expansión.
Is there a final slide?
I don't believe there is a final slide.
All right. Well, we thank you for your time this afternoon. And we will complete this, all of these questions that you have submitted to us. We'll get this posted. The recording of this webinar should appear within the next 2 business days on our website. A reminder that I do have a holiday though coming in here in this 2 business days. Thank you, everyone.
Gracias por participar. Esta grabación se estará disponible dentro de 2 días. Todas las preguntas que se han hecho serán puestas en línea con sus contestaciones.